Musculoskeletal physical therapy that treats orthopedic disorders, including sports injuries, is one of the largest physical therapy clinical specialties. Orthopedic physical therapists examine and treat patients with health problems related to the musculoskeletal system. Physical therapists that are specialized in this area are trained in orthopedic manual physical therapy and provide patients with the latest in evidence-based interventions. Patients who have suffered injury or disease affecting the muscles, bones, ligaments, or tendons of the body will benefit from assessment by a physical therapist specialized in orthopedics. General physical therapy goals in musculoskeletal clinical practice include the following: maximizing the patient's function, alleviating the patient's pain, decreasing abnormal stress on the joints, ensuring the patient's use of proper posture, promoting tissue healing, range of motion, and flexibility. Examples of musculoskeletal disorders and interventions: degenerative joint disease. Degenerative joint disease, or osteoarthritis, is a type of arthritis marked by progressive cartilage degeneration in synovial joints and vertebrae. The main goals of physical therapy for degenerative joint disease are the following: management of the inflammatory process, pain control, promotion of functional activities using task modifications such as reachers, sticks, or assistive devices such as canes, walkers, or crutches, and also decreasing weakness and increasing flexibility. Rheumatoid arthritis. Rheumatoid arthritis is a musculoskeletal disorder characterized as a chronic, inflammatory, systemic disease affecting the synovial joints. Physical therapy for rheumatoid arthritis uses exercises for the prevention of deformities and maintenance of joint motion. Special splints and other devices to make dressing, bathing, cooking, eating, and performing daily activities easier are often recommended to prevent or at least to reduce deformities. Osteoporosis. Osteoporosis is a systemic condition and metabolic disease involving a wasting or deteriorating of bone in mass and density. Osteoporosis is the most common disorder in the group of musculoskeletal disorders of bones and soft tissue. The goal of physical therapy in treating osteoporosis is to restore a patient's mobility, function, strength, and confidence. Weight-bearing activities such as walking or jogging and resistance exercise build muscle strength as well as improve patient's balance and body awareness, thereby reducing the risk of falls. Tendonitis. Tendonitis is an inflammation of the tendon as the result of microtrauma from prolonged overuse, improper activity, direct blows, or excessive tensile forces. Physical therapy goals for tendonitis include the following: reduction of pain and inflammation, correction of muscle imbalances and biomechanical faults, and restoration of function. Bursitis. Bursitis is an inflammation of the bursa secondary to overuse, trauma, gout, or infection. The first step of physical therapy treatment for bursitis is patient education about the need for the following: to rest the affected area, to keep pressure off of the affected area, to try to limit activities using the affected joint. Sprains and strains. Sprains are tearing injuries to ligaments, and strains are tearing injuries to the muscles or the musculotendinous unit, composed of both muscle and tendon. Physical therapy treatment for sprains and strains depends on the severity of the sprain or strain. Fractures. Fractures are sudden breaks of a bone or bones. Physical therapy treatment for fractures depends on the severity of the fracture.
Special interest groups. Based on the American Physical Therapy Association, the special interest groups that fall under the orthopedic specialty include occupational health, foot and ankle, pain management, performing arts, animal rehabilitation, and imaging.
For this project, we had the opportunity to interview Dr. Mitchell Mayoni, board-certified specialist in orthopedic physical therapy and director of the Physical Therapy Assistant Program at Kaiser University.
So Dr. Maoni, how long have you specialized as an orthopedic?
I achieved board certification in 2005, so I guess going on 8 years now. I entered into orthopedics in 1995, but it wasn't until 2005 when I achieved specialization.
Why did you choose orthopedics out of all the other specialties?
Because orthopedic seems to fit my mindset. I am very much interested in the musculoskeletal system. I am also very much a biomechanical thinker. So orthopedics being a more biomechanical science, that fits my personality and my thinking patterns. So it seemed to be a perfect fit.
And you have to be passionate with whatever you're...
Absolutely.
Right. What are the board specialty certification requirements?
One, you have to have documented hours in that specialty area. So for orthopedics, you have to have at least 2,000 hours of direct patient care in orthopedics. And then you must sit for the very rigorous specialty examination and pass that examination.
How would you describe the PT and PTA's relationship within the specialized area?
It's the same as in any other area of physical therapy. The physical therapist assistant will work under the direction and supervision of that specialist, following a plan of care. It would behoove the PTA to have an interest in the musculoskeletal system and also have that biomechanical mind so they understand treatment procedures. The American Physical Therapy Association also offers certification for PTAs in advanced proficiency in orthopedics. So it behooves that PTA working in orthopedics to work under a specialist and get that proficiency and achieve that certification.
So what are the supervision requirements between the PT and PTA?
They are the same as in any other setting in the state of Florida, which is, if you're in an outpatient facility, supervision is done under general supervision, which means the physical therapist doesn't necessarily have to be on site. They just have to be within telecommunications within that geographical area. And if you're in an acute setting, then supervision is what we call direct, meaning that therapist would have to be on site and ready for a consult at any time. So typically, orthopedic specialists will work in an outpatient setting, so supervision then therefore is under general supervision.
Why would a patient seek a board-certified orthopedist versus any other physical therapist?
Because the specialist has demonstrated proficiency in that paradigm in the field of orthopedics. Not that a generalist couldn't treat an orthopedic condition, it's just that a specialist has proven advanced knowledge and proficiency and expertise in that area.
Okay, so you would say in this case, knowledge is power.
Absolutely, always.
Well, thank you so much for this interview.
My pleasure.
And this concludes our interview with Dr. Maoni.